Hi everyone, Dr. Soni here, and today we're going to be doing laser tattoo removal. As you can see on the screen, that's the tattoo we started out with, and we've done 5 or 6 visits already. The tattoo is on the foot, and you can see that it's a very dense, dark colored tattoo. Sometimes a tattoo like this can take multiple visits, including up to 10 to 12 visits. Even then, there may not be a guarantee that we get all the ink on. Most of the tattoos, we can at least get about 90 to 95% removed. And a lot of them, we also get up to 100% removed. But it just depends on the type of ink, the depth of ink, the density of the ink that was used, and the location. Typically, tattoos kind of on the lower extremity sometimes can take a long time to remove. As we know, tattoo removal can cause discomfort and in some areas can be extremely painful. Fortunately, most tattoos are small and almost everyone can tolerate pain for about 30 to 45 seconds. Larger tattoos are certainly more difficult. But as you start going towards the extremities, you have a lot more nerve endings near the foot, so it hurts. It's painful. I have a tattoo, and I've personally done a treatment just to kind of feel what it feels like. It was manageable but painful. What I have done in this case, because this does cause quite a bit of pain, is I've gone ahead and injected this area with an anesthetic agent, and oftentimes that mitigates the pain by quite a bit. Anywhere from about 60 to 100%. Sometimes you can still feel a little bit of pressure, a little bit of shock wave, kind of that sensation of the ink breaking apart. But we've went ahead and numbed it up, and so we're going to do a first pass today. Sometimes I will employ what's called an R20 method. In some instances, what you do is you're doing multiple passes on the same visit that can expedite the clearance of the ink. And we do a pass. As most of you may have seen, there's a little bit of frosting effect. That's not the tattoo being removed. It's just a little bit of separation of the skin, so it looks like the tattoo is removed. But we wait 20 minutes in between and then hit the same ink again. The benefit is when you do multiple passes on the same visit, it's like doing multiple treatments, and it does clear up the ink faster, but you have to be careful on certain skin types. On this client, she has a little bit more of that Mediterranean type complexion. So I'm more inclined to do just about 2 passes. On someone that may be lighter in skin color, we can do up to 4 passes. Again, the more passes you do, the faster you clear it up, but you have to balance that with the need not to injure the skin, cause pigment changes from the laser tattoo removal process itself, and rarely it can certainly result in scarring. And the problem with scarring where you have tattoo is then the ink gets trapped within the scar, and it becomes nearly impossible to remove that ink. So, here at Ethos, we try to kind of push the limits a little bit and try to clear up the tattoo as fast as possible. But in general, you don't want to sacrifice safety, or you don't want to injure the tissue anymore, because that can either prevent you from removing the tattoo anymore, or it can cause other issues for sure. So we've gone ahead and numbed her up, and I'm going to do my first pass right now. This is what's called a Q switch laser, and I'm just going to do a few pulses so you can hear that snapping noise. How are you doing with the pain? It's okay. It's manageable.
Yeah,
You're
so far
still,
so good.
yeah.
Yeah.
What are you feeling like right now? Is it like a sharp
It
pain
almost
still,
feels like
or
remember
pressure?
you would take a
Rubber band.
bands
Okay,
and snap you. That's kind of
but
how.
it's not like what it feels if I don't numb it up.
No,
Like that's, no,
which we tried.
which we've tried. Yeah. So again, most of this is numb. Well, if you see her foot kind of twitching a little bit, we may not have gotten. And you can see how it's white right here, and that's from the anesthetic, because it contains a little bit of epinephrine, which results in blanching. And again, you can kind of see a little bit of that frosting develop. And that's not the tattoo clearing up. That's just the skin separating a little bit. Now, when you first do tattoo removal, sometimes you can get blistering, scabbing, crusting. But usually if that's going to occur, that's the first or the second treatment. Subsequent visits don't reveal it. So we've done one pass. This is good treatment. We can kind of see the edema and swelling kind of developing. I'm going to have this young lady wait for 20 minutes, and then we're going to kind of zap the ink again, and trying to break it down a little bit more. And that will help kind of clear the tattoo. Most of the times you're waiting 6 to 8 weeks between treatments. Sometimes, especially when we have slightly darker skin or Mediterranean skin, we may make our patients wait up to 3 months in between treatment. I just find that it's a safer way to do things. Typically, we can minimize the risk of pigment changes. And while there are many tattoos, we can get nearly 100% to 100% gone. Sometimes the skin where the tattoo was may not look completely the same as the surrounding skin. It can look a little bit lighter. It can even look a little bit darker, or sometimes there could be some residual ink that's a little bit deep or stubborn that becomes very difficult to treat. At Ethos, we have 3 lasers for tattoo removal, including a Pico Shore platform. So we have a lot of options and opportunity to remove all sorts of tattoos, including multicolored tattoos and ink. So you can see that in general, with proper anesthetic, it's a painless process. If it's small enough, we can provide a little anesthesia, but if it's certainly a large tattoo like a chest piece or half sleeve or full sleeve, it's very difficult to numb that entire area with injections. And typically, the numbing creams don't really work that well when it comes to tattoo removal. And the pain from the process can be described as a rubber band snapping, or it can be described as splatters of hot grease landing on the skin, or tiny hot searing needles going into the skin, or a combination of all three. Again, can be a little bit of discomfort, but cold air, injection with anesthetic. There's multiple different ways to make it comfortable. So hopefully this answers some of your questions, and thank you for joining us today.